Welcome back to the deep dive. Today we're tackling a really interesting medical puzzle. We're going deep into chronic hemorrhage in horses. And as always, our mission here is to take the source material today that's excerpts from chronic hemorrhage in horses, diagnosis and treatment, and really pull out the key stuff for you. Give you that shortcut.
Yeah.
Because this topic, it's surprisingly complex.
Oh, it absolutely is. It's often incredibly subtle.
Yeah.
Chronic hemorrhage in horses, well, it can hide really well.
Like a real detective story for the vets and owners.
Exactly. You really have to look beyond the obvious signs. And our sources today, they really get into why it's such a challenge.
Okay, so let's dive in. The first big thing that jumps out from the sources is that chronic hemorrhage. It's actually pretty rare in horses.
It is, thankfully, rare.
But when it does happen, it's really sneaky.
That's the key word, sneaky. And it's mostly down to the horse's own body, their amazing physiologic adaptations. They can compensate for blood loss incredibly well.
So well that you might not see any clinical signs.
Right. Not until the packed cell volume, the PCV, drops way down. We're talking critically low, less than 0.12 liters per liter, according to the source.
Wow. Okay, so their body is essentially masking the problem.
Pretty much. The regenerative responses, the bone marrow trying to make new red blood cells, it tries to keep up. For a while, at least.
And there's a difference depending on where the bleeding is.
Right.
Internal versus external.
Yes, a really crucial distinction.
Yeah.
With chronic internal hemorrhage bleeding inside the body cavity, say the horse can actually scavenge some of that lost material.
Like recycling.
Exactly. They can reutilize some red cells, iron, plasma protein. But with chronic external hemorrhage bleeding out of the body, like from the gut or urinary tract, all that is lost.
That leads to bigger problems.
Potentially, yes. If that external bleeding goes on long enough, you can end up with deficiencies, especially iron deficiency, and that directly hits the bone marrow's ability to make new red blood cells.
Got it. And the source material points out something interesting, and it doesn't seem to favor any particular breed or sex or age.
Nope. It seems it can really affect any horse, which makes it even harder to predict.
Okay, so if it's so sneaky, how do you eventually spot it? What are the clues we should be looking for? Because the signs seem to show up really late in the game.
Yeah, that's the tricky part. Those really obvious overt signs like a super fast heart rate tachycardia or rapid breathing, tachypnea, or just profound weakness.
The dramatic stuff.
Right. That often doesn't kick in until that PCV is already critically low. Below that 0.12 mark we mentioned, by then, things are pretty serious.
So you could have bleeding happening for weeks, maybe months, and not see those big red flags. What about subtler things? The sources mentioned pale gums.
Yes, pale mucous membranes. Also, maybe exercise intolerance. The horse just doesn't have the same stamina. And you might notice their heart and breathing rates shoot up much more than usual, but maybe only when they're stressed or exercising.
So under pressure, the cracks start to show.
Exactly. And here's another key point from the sources. Often, the signs you do pick up on are actually signs of the underlying disease that's causing the bleeding in the first place.
Ah, okay. So the bleeding itself is a symptom of something else going wrong.
Precisely. And figuring out that something else, the source of the bleed, is everything. It dictates how you diagnose and how you treat.
Okay, let's break down those potential sources. Our material lists quite a few. Let's start with the GI tract, the gut.
Yeah, the gastrointestinal tract is a common area. Think severe parasitism worms. That's a huge issue in horses.
Still a big problem.
Absolutely. Also, ulceration somewhere along the GI tract, and neoplasia, tumors or abnormal growths.
Right. Okay, what about the urinary system? Kidneys, bladder?
The renal or urologic system, yep.
Yeah.
You could have hemorrhagic cystitis, which is bladder inflammation with bleeding. Urolithiasis stones.
Painful stuff.
Very. Trauma can cause bleeding there too. Neoplasia again. And pyelonephritis, which is a pretty nasty kidney infection.
And the respiratory system. I know exercise-induced bleeding is a thing.
EIPH, yeah, exercise-induced pulmonary hemorrhage, that's definitely one, especially in performance horses. But also things like ethmoid hematomas, those are blood-filled masses in the nasal area. Guttural pouch mycosis.
That sounds bad.
It is bad. A fungal infection in the guttural pouches, it can be life-threatening. Also fungal rhinitis and, again, neoplasia in the airways.
So gut, urinary, respiratory,
Hmm.
any other major categories?
Well, the sources list some miscellaneous causes, too. Things like immune-mediated thrombocytopenia.
Okay, what's that?
That's where the horse's immune system basically attacks its own platelets, the cells needed for clotting. So low platelets means bleeding issues. And then there are other broader clotting disorders, coagulopathies.
Wow, that's a lot of potential culprits. It really covers so many body systems. No wonder this deep dive is useful, puts it all in perspective. So, faced with all these possibilities, how does a vet actually figure it out? What's the diagnostic journey like?
Well, it's definitely detective work. First, you have to consider other things that might look similar, the differential diagnoses.
Hmm.
Like, could it be anemia of chronic disease or maybe a low-grade hemolytic anemia where red cells are being destroyed? You
Hmm.
rule those out, then you hit the lab work.
Blood tests, urine tests.
Exactly. CBC, biochemistry, urinalysis, they're foundational. For example, seeing macrocytosis, which means bigger than normal red blood cells, or a high MCV, mean cell volume. That suggests the bone marrow is trying hard to regenerate cells. It's a clue.
Okay. And what points specifically to chronic blood loss?
You look for a specific pattern. Microcytic hypochromic anemia. That means small, pale red cells. Combine that with low iron in the blood, low iron stores in the marrow, and a high total iron binding capacity. That whole picture screams chronic blood loss leading to iron deficiency.
Gotcha. Small, pale cells, low iron.
Right. Now, low protein in the blood hypoproteinemia that often points towards external blood loss because protein is leaving the body, though sometimes protein levels can look normal because the body compensates.
Ah, the compensation again.
Oh.
Tricky.
Always tricky. But here's a potential aha moment. Finding high levels of bilirubin, especially indirect bilirubin, that strongly suggests internal bleeding because the body is breaking down those trapped red blood cells internally.
Okay, that's a key differentiator.
It can be. Also, signs of chronic low oxygen hypoxia can sometimes show up as elevated liver enzymes or creatinine, and of course, if you see blood in the urine, even microscopically.
Point straight to the urinary tract.
Exactly. Renal or urologic problems.
So the lab work gives you a ton of clues. What about seeing inside? Imaging.
Imaging is crucial too. Ultrasound is really useful. You can use it to look for things like NSAID-induced right dorsal colitis, that's inflammation and bleeding in the colon from pain meds.
Right, you mentioned NSAIDs earlier in prevention.
Yeah, it's a known risk. Ultrasound can also help find masses, tumors hidden away in the abdomen or the chest. And then X-rays, radiography are great for looking at the upper respiratory tract, like sinuses or those ethmoid masses.
Makes sense. Are there even more specialized tests?
Oh, yes. Sometimes you need to dig deeper. A bone marrow aspirate can be very telling.
Taking a sample of the marrow itself.
Correct. You look at the ratio of myeloid cells to erythroid cells. If that ratio is less than 0.5, it confirms the marrow is working overtime, making red blood cells regenerative anemia.
Okay.
Then there's fecal occult blood testing, checking the manure for hidden blood, essential for suspected GI bleeds, and fecal exams for parasite eggs, especially if there's weight loss or poor deworming history.
Right, the parasite connection.
Always keep that in mind. And then endoscopy, using scopes to look directly inside.
Like gastroscopy.
Yep, gastroscopy lets you see inside the stomach and duodenum, looking for ulcers or maybe gastric cancer. Cystoscopy looks inside the bladder and urethra. Upper airway endoscopy checks the nasal passages, guttural pouches, trachea.
So you can potentially see the source of the bleed directly.
Yeah, that's the goal. You might see rhinitis, a tumor, fungal plaques in the guttural pouch, an ethmoid hematoma, or just active bleeding. Sometimes, for really tricky cases, you might analyze fluid samples from the abdomen, or a tracheal wash, or BAL fluid.
EL.
Bronchoalveolar lavage, washing fluid into the deep airways and collecting it. In those fluids, finding cells that have eaten red blood cells, erythrocytophagia, or cells containing iron pigment, hemocytophages, that confirms internal bleeding in that location. And finally, if you find a mass with ultrasound, you can often do an ultrasound-guided biopsy to figure out exactly what it is.
Man, it really is a multi-layered investigation. No single test tells the whole story.
Not usually, no. It requires putting all these pieces together.
Which leads us to treatment. If you finally pinpoint the cause, what then?
Well, the absolute cornerstone of treatment, based on our sources, is identifying and eliminating that underlying cause. Whatever is causing the bleeding, you have to address that.
So just giving blood isn't the main answer.
Generally, no. And that's actually a surprising point in the sources. Blood transfusion is usually not needed for chronic hemorrhage. The body has adapted. Unless the PCV is profoundly low, say below 0.10 ll, or there are really clear signs that tissues aren't getting enough oxygen, like extreme weakness or collapse, then yes, a transfusion might be life-saving.
But usually, fix the cause first.
Fix the cause. Now, if lab tests confirm a true iron deficiency is hindering recovery, then iron supplementation is needed. The go-to is oral ferrous sulfate.
Okay, and there was that warning.
A critical one. Avoid injectable iron dextrin solutions. The sources are very clear they can cause fatal anaphylactic reactions in horses. Stick to the oral route if iron is needed.
Good to know. So once treatment for the underlying issue starts, how do you monitor progress?
You monitor closely. You need to see if the horse is responding to treatment for, say, the ulcers or the infection or whatever the cause was, and you track the blood work.
Checking the PCV regularly.
Exactly. Usually weekly PCV checks, you'd expect to see it gradually climb back into the normal range over typically 6 to 12 weeks. It's a slow process.
Takes time to rebuild those red cells.
It does. Thankfully, doing repeat bone marrow checks usually isn't necessary. A big part of follow-up is also client education, making sure the owner understands the underlying disease and any ongoing management needed, like, say, consistent parasite control, if that was the issue.
Right, preventing recurrence.
Absolutely. Yeah. And ultimately, the prognosis, well, it completely hinges on whether you can successfully identify and treat that root cause of the anemia.
It all comes back to finding that source. So thinking about prevention, you mentioned parasite control and NSAIDs earlier. Are those the main preventable causes?
Based on the sources, those are the two biggies highlighted for prevention. Making sure NSAIDs are used correctly, right dose, right duration, monitoring that helps prevent the colitis issue.
Okay.
And having a really solid, effective parasite control program is just fundamental equine management, and it directly addresses a major cause of chronic GI blood loss.
So some causes are definitely things owners and vets can be proactive about.
Definitely.
What a journey. We've gone from how incredibly subtle this condition can be all the way through the really detailed diagnostic process and landed on the fact that treatment is all about nailing down that primary cause.
It really does highlight how sophisticated the horse's body is, both in its ability to compensate and, well, its ability to hide problems. It makes you appreciate the level of detail needed in veterinary work.
Absolutely.
And it kind of leaves you with a thought, doesn't it? If horses can